Welcome to Acharya Nidana Academy. From the past several videos, we are discussing how to document the case history in terms of chief complaints, which are to be mentioned in patient's own words and which have to be mentioned in the chronological order. After that, we were discussing about the history of present illness, how to document the presenting complaints in terms of their occurrence regarding the onset, duration, location, radiation character, severity, course of the symptom, aggravating and relieving factors, and negative history. After that, we have discussed regarding the past history. So, how to record the past history regarding the childhood illnesses. So, the illnesses, they are the major illnesses, the list of the major illnesses from the childhood, if they are able to recall or not. And regarding some of the medical illnesses, previous history of that, and surgical illnesses and psychiatric illnesses. After that, we have discussed how to document the treatment history. So regarding the names of the medications, regarding the doses, regarding the duration of treatment, regarding the route of administration of the medicine, etc., etc. Plus, what are the different ways of the giving the treatment in terms of the Ayurveda hospitals, and how that will be helpful in the diagnosis, what they have, the previous diagnosis, etc., that were being discussed. Today, we are going to discuss the history, the family history. When you say about family history, the main purpose of family history is to find out whether there are any family members who are having a similar illness relevant to the presenting complaint. So, for example, if the person is suffering from diarrhea, we are going to inquire about the family members who are having the diarrhea. If the person are having the cough, we are going to inquire whether regarding the family members, whether they are having the cough or not, or presence of fever is present or not. Or if the person is not having that, then we are going to inquire about the presence of any other illness. For example, if the person is suffering from the diarrhea, that indicates that the person is suffering from alimentary canal dysfunction. We are going to know any other illnesses. For example, if they are having some kind of the, or you say that the other infections, for example, respiratory infections are present or not, which are going to get identified by cough, breathlessness, etc., fever, etc. And certain non-communicable diseases such as the joint pain, which may be indicative of the degenerative conditions, etc. So like that, any other illnesses, that is, we are going to inquire there. And in this, we are going to note about the status of health of their family members. They are going to get noticed, documented there. Suppose if the any kind of the death has happened, we are going to note age and cause of death in case of the first degree relatives. That is, we are going to note. Certain vague terms, they are being used by the patients, such as old age. That means death has happened due to old age, or stroke, or fits, or convulsions, or heart attack, or debility, such as emaciation, etc. They are being used by the patients. Those different terminologies have to be recorded there. As far as other aspects of family history are concerned, first of all, we are going to note about based on the environmental risk factors. For example, if the person, there may be environmental risk factors in the sense the risk of transmission of infection, such as tuberculosis, wherein the people are residing in very closed or crowded places, or otherwise the transmission of infection. For example, the repeated sexual unprotected sexual intercourse. There may be a possibility of sexually transmitted diseases, or otherwise AIDS, acquired immunodeficiency syndrome, etc. Or is there is any possibility of waterborne infection such as typhoid, etc. in case of contaminated water intake. Next, about regarding the poverty. So that means there may be a possibility of risk of spread of infection that may be possible. Common dietary habits, they are being uh, usually followed by one particular family members, or otherwise smoking habits, or poor personal hygiene, or the poor social hygiene. These are the environmental risk factors we are going to analyze in case of eliciting the family history. Certain coincidental conditions wherein the common diseases that can be occurring in the families, such as cancer. In one of the family, it was being happened, the cancer has occurred, and if you look into the history, he was the 13th patient who had the history of cancer. Of course, the patient had the colonic cancer, but when you look into the history, they were having the cancer of different organs as such. This is about the coincidental factors as such. When you think about the other aspects, such as hereditary diseases, there are certain diseases which are possible to run in the families, such as diabetes mellitus, etc., that we are going to inquire there. Why we need to inquire about these informations? For the early detection of the diseases. Another major aspect that we are going to inquire, that is history of consanguinity. That means consanguineous marriages. That is marriage between blood relatives. So this is essential to note about the certain familial diseases. That means which are usually run because of the autosomal, chromosomal dominance or recessive genes. For example, Deccan's muscular dystrophy, which is considered to be one of the diseases which are usually running in the families. So those aspects we are going to note. As far as nature of inquiry, how we are going to inquire about the family history, that is, we are going to inquire about the health status of grandparents, then parents, siblings, children, and grandchildren. They are going to get inquired there. So this is helpful in noting the genetic tendency of the disease. When we note about this, so here status of the health of the spouse is not considered in this regard. Why? Because of the genetic makeup of the spouse will be usually different, particularly in India. Because in India, Sagotra marriages are usually not practiced. Then where this health of the spouse is coming into picture, that is to rule out the infections which are prevalent in that particular families. In that particular situation, the role of the health of the spouse, that will be coming into picture. When you think about the noting down or documenting the family history, so here it is a pedigree chart. So in the left chart, these are different examples, whereas on the right, this is how we are going to write the pedigree chart. So here, the square that represents the male and circle that represents the female. When you think about the line between them, that represents the marriage between them. And when you think about the two lines, that indicates consanguineous marriage happening in the couple. So this the next one that is usually helpful in determining the generations. First degree relatives, second degree relatives, third degree relatives, like that. And here that is the identical twins. So here specifically twins, of course, they are females. They are non-identical ones. So here that is affected diseases. So here the as such, if this is being mentioned, it is the male is being affected, and if this is there, it is the female that is being affected. So if the cross is being given, then it is suggestive of the history of the diseases. In case of the males, female and female. That means they are not having the disease, but they had the history of the disease as such. And the this particular symbol indicates the carrier stage, whereas the line with the drawn line, oblique line, that indicates the diseased cases as such. That is, in case of the circle, it is diseased female and diseased male. And the this particular phenomena that indicates the third gender. When you think about the example of writing this, so here the parent, that is the father and mother, their children, that is the both are their children, both females, but male is deceased. Here it is the marriage has happened, and here that is what the three children, two males and one female. Female is being deceased. This is how the pedigree chart is drawn. When you think about the questioning in cases of the family history, this will be the order of the questioning. First of all, are you married? Is your spouse well? If they are not, if the next question will be, do you have children? Recording the age and gender. Have they been seriously ill? Have you lost any children? If the children are being lost, then record the age and cause of death. That has to be mentioned. Do you have brothers and sisters? Note the age and gender. Then, have they been seriously ill? Have you lost any brother or sister in that particular situation? Record the age and cause of death. Are your parents are living? If yes, are they have been seriously ill? If no, age and cause of death have to be recorded. Are your grandparents are living? If yes, have do they have any serious illness? If yes, note them. If no, then age and cause of death has to be recorded. Do you have anyone in your family having the similar illness with the symptoms like yours? So that means here we are going to seek the possibility of infectious disease. So the next question, do you know any disease affecting more than one member of your family? This is to determine the hereditary diseases as such. So this is how the sequence of questioning will be done in case of eliciting the family history. So the take-home messages from today's discussion, that is, family history is helpful in determining the health status of grandparents, parents, siblings, children, and grandchildren. So this is helpful in determining the environmental risk factors such as spread of infection, poverty, etc., and certain coincidental diseases such as cancer, etc., and certain other hereditary diseases, as well as noting the common dietary habits and smoking habits. Pedigree chart has to be drawn for the easy understanding of familial diseases. Dear members, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one topic that you'd like to hear in the coming days in this channel? Mention in the comment box below. And if you are liking this particular video, then put a thumbs up and spread this particular video to the maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.